Should you have ultrasound in your aesthetic clinic? What most injectors get wrong. Ultrasound in aesthetic practice, do you really need it? What if I told you that having an ultrasound device in your clinic does not necessarily make your injections safer? In fact, in some cases, it can create a false sense of security. Ultrasound is a powerful tool, but only if you understand what it can do, and more importantly, what it cannot do. Let's start with the reality. Many injectors believe that ultrasound allows you to see vessels clearly and avoid them during injections. But this is not entirely true. Most of the arteries that matter in aesthetic practice are less than 1 millimeter in diameter. That means they are already at the limit of what many ultrasound devices can reliably detect. And it gets more complicated. Vessels can constrict, especially in cold environments. In mobile areas like the lips, structures are constantly moving. And the ultrasound probe itself is not a pinpoint, it's a flat surface. So you are not scanning a single precise point. You are interpreting a broader field. Which means this: you cannot assume that because you don't see a vessel, it isn't there. So if ultrasound has limitations, what is it actually useful for? There are three main roles. First, emergency management of vascular occlusion. Ultrasound can assist in identifying filler and guiding treatment with hyaluronidase. But the most important concept here is this: the endpoint is not what you see on the screen. The endpoint is clinical. You are looking for return of capillary refill, improvement in pain, recovery of tissue perfusion. Even if filler remains visible on ultrasound, you continue treating until clinical improvement is achieved. And remember, emboli in very small vessels are often not visible on ultrasound. If there is no improvement despite appropriate treatment, escalation to a hospital setting with advanced imaging and specialist support is critical. Second, assessment of filler placement and complications. Patients may present with lumps, irregularities, or delayed swelling. Ultrasound can help differentiate: is this filler? Is it migration? Is it a granuloma or another pathology? This is where ultrasound becomes very useful, not as a prevention tool, but as a diagnostic tool. Third, education and understanding anatomy. Ultrasound can be an excellent teaching tool. It allows injectors to visualize tissue layers, depth, and how filler behaves in real tissue. It can also be used to educate patients. But remember, patients are not paying you to show them anatomy. They are paying you for a safe and effective aesthetic result. So now the key question: should you have ultrasound in your clinic? The answer is, it depends. Ultrasound is not a shortcut to safety. It requires significant training and experience. Professional sonographers train for years to interpret images accurately. Smaller devices have limitations in resolution and depth. And even with high-end systems, not all vessels are visible. Ultrasound can support your practice, but it should never replace anatomical knowledge. Because at the end of the day, the safest injector is not the one with the best device. It's the one who knows exactly where not to inject. Thanks so much for watching. Don't forget to like, comment, and subscribe, and share this with someone who'd find it useful.